Peace, peace, peace. I am Phillip Roundtree, and you are tuned into the April 28th edition of Rhetorically Speaking. I look a little different, don't I? Yeah, I know I look a little different than from yesterday's show. I don't know what it is. I was in the bathroom, and I was just like, I feel like I had COVID particles in my hair. So I already cut down the locks, but I still felt like it was some COVID left over. And so I was just like, you know what? New start, fresh beginnings, and we're just gonna do it like that. So don't be alarmed. Just still Phil Roundtree here to provide y'all with some information here on rhetorically speaking. Uh, Hopefully you're still quarantining. It was 65 degrees here in Philadelphia, which meant that it was like 75,000 people out again today in groups of 7 and 8, just doing what they do. And so I wanted to bring a doctor on so we can really have this conversation about quarantining. Is it something that's a real strategy to curb COVID-19? I also wanted to get his perspective on just where we are. I know we're currently in a state of debating should we open up the country. We see all the militias. That's what I'm gonna call them, militias. Some of them probably white nationalists going to going to the various state capitals to protest, saying, "Listen, we need to open the state up, whether it's for economical purposes or just because we don't want the government to tell us what to do with our bodies." The irony in that. I also just wanted to get a real perspective, a on the grounds perspective from somebody who is actually dealing with patients who've contracted COVID-19 and who puts themselves at risk on a daily basis to help treat patients who have COVID-19. And so I had to delve into my inner circle. I know you hear me talk about. I know three white people that I'm really cool with, and and Dr. Travis Kenny is one of them. So I just want to say, thank you, Dr. Kenny, for coming on and taking time. I know it's probably time for you to decompress in preparation for tomorrow. So I appreciate you taking time for your busy schedule to join me today.
Absolutely. Thanks so much for having me on. I'm happy to spread the word for whatever we got to do during this kind of it's a shitty time, no matter how you look at it. So whatever perspective I can provide is good.
Word, word. Well, again, I appreciate you. And so, just to give a little bit of background, you are a hospitalist, and so you're the doctor who sees the patients once they're admitted to the hospital.
That's correct. Yeah. So um, it's kind of a newer specialty for the last 20 years. So I tell people, if you've ever seen the show Scrubs, you can imagine what those doctors do. They're almost always in the hospital, right? I don't see patients in an office. I don't have an outpatient practice. So I see you in the ER once you are going to be admitted. I do the admission work, and then I usually follow you until you're discharged. And unless you're on some sort of specialty service, like some neurosurgery service, you're probably under my care
Okay.
within the hospital. So I treat any and all kinds of reasons to be in the hospital.
Cool, cool. So I just want to get right into it, man. I know this
Yeah.
conversation on COVID is really big. One of the reasons why I wanted to have you on again was, we talked about this off air, but this ER doctor Lorna Breen, and for those who are watching, I'm gonna pull up her picture right now. Um, let's pull that up. So, Dr. Lorna Breen, she was a Manhattan ER doctor who killed herself on Sunday after serving on the front lines of the coronavirus battle. She was distraught because she'd gotten the contagion, so she contracted coronavirus while working, trying to help and save the people. And she returned to work they say rather early, which was about a week and a half, and they told her to go back home. And so with that, I'm sure her mental capacity at that time, she probably was dealing with, extreme stress, extreme frustration, just in dealing with corona as a doctor. But then to recognize that she's a patient as well, that probably added some additional stressors to her. And so, unfortunately, she decided to to take her own life by suicide, which I'll talk about a little bit later, just on my perspective on suicide. But when you heard that story, because I'm sure that made the rounds amongst doctors,
Yeah.
what were your initial thoughts?
Uh, Heartbreaking, especially knowing that she had contracted it. I just found out one of my best friends that I trained with is also a doctor down in Atlantic City, and he's actually hospitalized with the virus right now. You know, my age. Um, we're probably the worst patients you can imagine. So when it comes to us being sick and having to, to deal with this, we're constantly exposed to infectious diseases and stuff, but we don't often really consider ourselves that much at risk. But with this, it's completely different. Um, I think when I was rereading the article about it, I noticed a few things that one, it just probably a huge sense of hopelessness on top of everything else.
Yeah.
Um, I mean, we're hit pretty hard here, but we're nowhere near compared to anything that New York was going through. Uh, the density of that city with the population it has, I mean, it was just insurmountable to be able to take care of that many people who got sick that fast. And you feel helpless to help them. Uh, so I can only imagine how she felt. And then the strain of having it yourself and being told you can't come to work and help, you know, of course, they're always going to say that she had no prior mental health issues, but I'm interested to hear your perspective on that going forward because I don't know if that really always does. I don't think that always makes a difference. I mean, it is what it is when it happens. But
Yeah, yeah. I mean, she could have prior mental health history, but a lot of times it can be just something very acute, something that
yeah,
happens right then in that moment. When I go around and speak, I tell the story about a gentleman who he died by suicide. He broke his arm, and his girlfriend broke up with him. Right, and so to you and I, and to a lot of people, we're like, okay, that's not a lot. But with those two things happening in that span of less than a week, again, the pressure and the stress from it is insurmountable, and so they make that decision to die by suicide. So yeah, I don't necessarily know if it matters if she did or not. I don't know. Maybe she over identifies with the role of doctor, right? Like she looks at
yeah,
herself as being the person to help on the front lines, and her self worth might have been attached to that. I don't want to speculate. Um, However, because I know that this is what happens when we're in these helping professions, we become so attached to the work that we do that we forget that we're still human beings. We still need to be cared for. We still have to show ourselves grace, and we still have to be mindful about how we're showing up. And so again, you can't service the people that have corona, and then here you are with corona, and it's just like I'm damned if I do, damned if I don't. And then I don't know, maybe we talk about that idea of people who have corona, they have to isolate from others, right?
yeah,
Isolation is a is a risk factor when we talk about depression, anxiety, which can lead to suicide. So
absolutely.
yeah, so it's just tough, and our thoughts are with their family, and with other medical professionals who are out there, and it had me thinking about just the do we are we really considering the mental health of those who we call essential workers uh right now during this time, because again, whether it's the SEPTA driver, whether it's the doctor, those who are out there truly on the front lines servicing the people, are we really concerned about their mental health? Do you feel like your mental health is being considered, whether it's by your colleagues or whether it's by hospital administration? Do you feel like it's being looked at and as diligently as it should be?
No, definitely not. And I don't think anybody that answers truthfully would say yes, 100%. I think in a lot of professions, the idea of wellness has popped up in the last few years, and that's especially true in healthcare and with physicians. But it's a lot of lip service. I don't think they do much more than send an email or a link to a wellness website.
Oh
Um,
wow.
you know what I mean? Talking about things like that. And some places do a better job than others. Um, but for us, I mean, there's a lot of, pats on the back and thank yous and emails and, you know, spending money on signs about heroes like this. But I don't think it's really the focus isn't there. And I don't know if I can necessarily blame them because they're still trying to put out the fire that they have with being short staffed and having enough people to care for the surge of sick patients that are in the hospital.
Yeah.
So, I don't think that that's really a top priority. I think that, if I were to ever, feel that way, or, I'm pretty accountable to my wife, and she can kind of tell when things are going on, and she could take a step back and say, hey, what do you need from me? Are you feeling any way? But if I didn't have that, I don't know if I could necessarily reach out to somebody at work. To just be honest, I don't want to shoot down any one institution, because I don't think that's different here than anywhere else, really.
Yeah.
If it were, I think that's the exception,
Yeah.
not the rule. Unfortunately, that probably is a long conversation for another time too, about why that is. But for sure, physician suicide, they always tout this. I mean, from my first probably day or month in medical school, they talk about the rate of suicide, physician suicide is, X amount higher than
Yeah.
this profession, say it is with military or whatever other helping or serious profession where you may end up having PTSD or other exposure to horrible things is. But they really just identify a problem but not a solution.
Yeah. So with that said, what does, I know you talked about how your wife is a support, which is, an amazing thing. What does self-care, especially during times like this, because I know, you've come to my group, many times
Sure.
just to decompress with the other brothers, but outside of that, especially during this tumultuous time, what does self-care look like for you?
Uh, I mean, I haven't been taking the best care of myself till recently. Mostly, what I've done recently is I started working out again. You know, Obviously now that there's no gyms, I found a way to, you know, yoga at home. Uh, I've invested in a couple, like heavy sandbags and stuff, things you could do around. Just because, I see myself, the obesity epidemic, and I kind of scared myself with COVID because that is who it hits harder.
Mm,
And I'm no stranger to my size. It's something that I use to empathize with other patients about how hard it is to make good choices, even with good information. But so one of the things I've done a lot of is trying to eat better, basic things that you should do for yourself anyways. But it's made a bigger difference for me than I would have thought. Tried to exercise a lot more, and then on my off weeks, trying to separate myself from my job. Identifying as doctor 24/7, I don't think it's healthy.
mm.
Um, there's a guy I follow on Twitter named Mark Reed, who I think goes by the Twitter handle like Medical Axioms, that kind of talks about when you go to when you're a doctor, it's like almost a stage play. You have to play that role. That's your role on stage when you're in front of patients, and it's not something you can handle 24/7. Um, I mean, that's just too much for someone to bear. That's a lot of burden to constantly be helping, and you know, especially with the especially with the old traditional way of thinking of medicine. I mean, I'm still working at times 24, 36 hour shifts,
Mm,
which we know is not healthy.
yeah.
Um, but it's either that or nobody's at the hospital. So you kind of get stuck in those positions. But when I'm not there, um, I still have to set aside time to read, keep up to date on articles, especially now. But always that's important. But there are certain days where I just don't think about medicine. I don't check my email. I don't read about it. I do anything but that. I think that's been the biggest thing.
Yeah.
Um, there are more steps probably to take, but those have been the biggest ones that have helped.
Word. For those who are just tuning in, that is Dr. Travis Kenny, who is a hospitalist. So he's the person who'll come and check on you after you're admitted in the hospital. He had to make it make sense for me. I was like, hospitalist, okay, and that's with me working in a hospital for 3 years.
Yeah,
So
yeah.
yeah, but they had me confined into the little corner with the psychiatrist, and it was just like,
Always, yeah.
yeah, at the back of the hospital, right?
That's always how it is.
Yeah. And so I know you mentioned this the obesity epidemic and how that plays a part in in uh, those who are most vulnerable for COVID-19. I just want to put some of these numbers out here. So today it says that the United States has surpassed 1 million known corona cases. Again, emphasis on known because everybody isn't getting tested. 57,000 people have died. Over 140,000 have recovered. I think we need to emphasize that a little bit
Yeah,
more, right? I think that would ease the minds of the people a little bit more to show that it's not necessarily a death sentence when you get it, but unfortunately when it's continuing to be pushed in your face. And so with these numbers, I reported on it last week with the passing of the rapper Fred the Godson. That underlying health issues like obesity, which accounted for, I believe, it was 41%, high blood pressure accounted for, I believe, 57%. So, have you seen that those statistics bear their fruit in the patients that you see?
yeah. And obviously, I'm not keeping records, and I don't have, this is nothing official. It's all anecdotal. But
Yeah.
and the other caveat is I'm only in the hospital, so the people I take care of are obviously the only ones sick enough to be in the hospital. So, but yeah, I'll tell you the sickest person, the first really sick person I had was a 31-year-old dude um,
Mm.
who was probably my size, but had no other medical issues otherwise. Um, and I think he got so sick we couldn't handle him in our ICU, like the smaller community ICU. He went to a bigger center. They still had to transfer him to put him basically on a lung bypass machine
Oh.
because he got so sick. We don't know enough about why this hits some obese people and not others, but it seems to certainly be a risk factor. The other ones obviously are high blood pressure, any heart disease, anybody that has kind of you know, a weaker protoplasm or weaker foundation to start is going to have a tougher time when this gets severe. Um, but it's been the same, but it's the same common things. People with high blood pressure, diabetes, obesity. Those are three things that are extremely prevalent, but um, they're all like a common foundation for doing worse with any disease that you can get or any infection.
Well, yeah, yeah. So I guess my next question, and along the same lines, because again, when we talk about the statistics related to COVID, what is the population with regards to race and ethnicity? I know the statistics show that black and brown folk are getting hit hardest by COVID due to, we talk about those underlying health issues, which we know comes from uh, racism not being addressed, with regards
Yeah.
to health outcomes. And so, what populations have you been seeing most of?
Well, I think almost only entirely African American persons of color. And that's, I think, a function of one, I work, Elkins Park is not necessarily thought of as, it's not really in Philly, but the population there, I don't see any different demographics than I would normally for sick patients. They're the ones who live in the area. The same is true in, the main campus at Einstein is in North Philly. So, but when I was talking to one of my colleagues who also works on his off weeks at Reading, he said, there's just all white folks, but I don't know about how much worse they're doing. I can't, because I'm not taking data.
Yeah.
I'm not, I can't say for myself, but there's no way I'd refute the idea that black and brown people are obviously way worsely affected by this than white folk because, uh, you know, we know for a fact that uh, let's say, for example, black women are believed less when it comes to being in pain. We
Mm.
know for a fact that is not because of any other reason than their race. There has been a study that has looked at that, and there's no reason to think that doesn't permeate to every other aspect of healthcare in terms of um, good chronic medical care, which would help alleviate some of the high blood pressure, obesity, and diabetes. Um, but almost my entire demographic thus far has just been um, African American and a couple, some persons of color, a lot of Latinx and uh, Southeast Asian,
Okay.
just for where I'm working.
Yeah.
But I see that's the same as it is with when they're sick from other things. They do more poorly than whites do any other time.
Okay.
Um, unfortunately, it's no different. That's the problem.
Yeah, yeah. And so that is Dr. Kinney, who is the hospitalist in the Einstein Network. And so I guess my next question would be related to just the equipment in the hospital. There's been so much hoopla and conversation between, we see Kumo and Trump, subtweeting each other and what
Yeah,
have you about the equipment, about ventilators and a protective mask. And we see that, we have to get outside parties to donate masks to hospitals, which is just atrocious in my view. So, what has your experience been with when we talk about the idea of proper equipment within the hospital setting?
It's not good.
we have masks, gowns, but we're so short on them that now we've developed, I guess, a process to re-sterilize the N95 that you've heard about. So
Yeah,
now when I come in, I get one a day, or it has been one a day. I write my name, my ID number on it, so that when I turn it in at the end of the day, supposedly it's getting sterilized and it's going to get returned to me, but I haven't seen happen yet. But um, I know we're at a point where we're taking disposable gowns, to cover ourselves for when we're, actually touching, interacting with patients. And we are spraying them down with a disinfectant when we're done, hanging them on the door to be used by the same person when they have to go back in the room for the day. And this is not isolated to Einstein. I mean, this is this is just one voice in a chorus of other hospitals that are doing the same thing.
yeah,
Um, because typically you don't need that many gowns or N95s. Usually, the only time I need an N95 mask is if I'm treating someone that's suspected or has tuberculosis, that they're in a what we call a negative pressure room, and that's few and far in between right now.
yeah,
Um, but for every person that goes into a room with someone like that, you need to have an N95, and ideally, you shouldn't be wearing it to the next room with somebody who may or may not have it to spread it. Um, so the equipment's just not there like they're saying it is. I'm not seeing it, which is scary. That's the scary part. So you have to be mindful, and it's gotten to the point where I don't wear a gown if I'm not going to touch, if I'm not going to go back in and examine a person and put my hands on them. I stay 6, 10 feet back and just try and talk to them from a distance. If all I need to do is talk to them, so that I don't have to waste the precious gown that someone else needs when they actually have to, draw blood or do something else.
yeah.
Um,
So with that, and there's a few things that you said. The fact that you have to turn the mask in, and
yeah,
for it to be disinfected, and then you get it back. But and I guess you're hoping that they disinfect it, right?
I hope so. Yeah, I hope I hope it's working.
Yeah, yeah.
Um, I
That's
mean, this just started, I think, in the last week, uh, so I don't have too much information on it. And I know it's part of the problem is that the cost is super expensive now. I mean, it's economics 101. The supply is not there, and
yeah.
the demand is sky high. So where it used to be 10 cents, 50 cents for a mask, it's like $4, $5 a mask.
Yeah, I saw
Um,
that. I saw it was Damon John who's on Shark Tank and the former owner of Fubu.
yeah.
He was price gouging.
Oh yeah.
He was selling the state of Miami. Believe it was a million N95 masks for $7 a mask, and they just agreed to it because they had no other choice.
Yeah.
It ultimately fell through, but just the simple fact of people are trying to benefit and make money from this instead of
Yeah.
recognizing that the humanity in somebody else and wanting people to be safe. I think it speaks volumes about where we are as a society and how we not only treat our most vulnerable, which are those who are come in contact with the coronavirus and who may test positive for it, but how we treat those who are working with our most vulnerable, right? Who are
Yeah.
also vulnerable in that capacity. So yeah, that's unfortunate. It was something else that you brought up. It just slipped my mind that I wanted to touch on. Yeah, I can't read. Hopefully, it'll come back to me.
Let
Um,
me just let me
Let
Go
me
ahead.
shout out then while we're speaking. This, and it's not just us. It's not just the nurses, not just the doctors, um, but it's the environmental staff, the people that are going in and cleaning the rooms, that are cleaning every aspect of the hospital. I mean, they're the ones that are also just as exposed, and they're having to use the same, limited supplies. Shout out to every one of them.
Yeah.
Those are the people I actually make closest friends with, and without them, there are times when we have limited amount of what we call negative pressure rooms, meaning that it generates a negative pressure so that no air gets out. Everything stays in the room. And that's important. So if you have to intubate somebody, meaning you put a tube down into their throat to put them on the ventilator, that is an extremely risky procedure with COVID because there's such a high amount of aerosolization, meaning that so much of the respiratory particles are getting out into the open that you can really only do that in a negative pressure room. So there are a lot of times when, we have a small ICU and we're intubating someone and then someone else is sick and needs it, but you need to have a 30-minute turnaround time for that to happen. And, I think our environmental staff, thanklessly, is doing a fantastic job, but they're just equally at risk and getting paid, pennies compared to what the rest of us make. And I don't think they get the respect they deserve for that. So shout out to them.
Yeah, no doubt, no doubt. Shout out to them. I know from my 3 years when I worked in a hospital, they played such an integral part. When you're working in a crisis unit and you have people doing any and everything within that unit, right? We're talking about enuresis. We're talking about so many different
Mm-hmm.
things that's taking place, and just to be there at the drop of a dime. So I can only imagine that they're still having to deal with these things, right? With
Yeah.
their regular duties. Then
Right.
on top of it, they have the extra. And
Yeah.
so yeah, and that goes for you guys as well, right? Like we talk about, like we forget about, yeah, there's still people who have cancer. There are still people who have the regular flu who might need to
Yeah.
be hospitalized. Those who might have some injuries of some sort, they're still coming in. That's not it's not like a moratorium, like, all
Right.
right, everybody stop. No, we're bringing all of these people in. And so, again, big ups to you and those within, your profession, everybody within the hospital setting who
Word.
are, who
Thank
are
you.
doing a yeoman's effort. So switching gears, and I guess this is the final question that I have, because I do want you to go and get some rest and decompress.
Appreciate it.
Um, just this idea of, do you think we're rushing to open the country back up, in your professional opinion?
No, I think we are rushing. I think we should slow down, especially where we're being hit hardest. Again, this is still, there's so much of it outside of what I've, studied. So continue with a grain of salt. But
Yeah,
one of the problems I think that occurred when we tried to explain to the public, the media and health professionals alike had an issue with this. We didn't really explain what it means to flatten the curve and why we're doing it. We're not doing it because we're trying to keep everybody from getting it. We know that at this point, that's almost an inevitability. We can't, we were past the point of containing the virus and keeping it here. At this point, we're just trying to slow its spread because if you look at what happened in Italy or some of those other countries where they were so overwhelmed with patients, they didn't have the beds or the ventilators, and they were having to make, they had to convene with, I guess what you would call triage crews, who would decide who gets a ventilator, who doesn't get a ventilator, based on some criteria, and using people who aren't caring for them so they can be, I guess, as non-biased as possible. So the goal was that we slow the spread so that when people do get sick, it doesn't happen so much that it overwhelms our system. Right now, we're kind of at capacity in our hospitals, but we're managing. If this got any worse, we'd be at the point where, you know, you're 75, you're older, you got this, you got heart failure, you don't get a vent. I'm sorry.
yeah,
It's just resource allocation because there just wasn't enough. And it kind of, and I know it's, and I try to prepare myself because if we did our job right, everyone should be able to say we overreacted because that's what it would look like. But it's still frustrating for people to think that we're overreacting. Right now we're at the point where we have shown that we've done somewhat of a good job flattening the curve, but any slip up and it could get worse.
yeah,
Um, so flattening the curve was not to stop everyone from getting it. And we should have also mentioned that flattening the curve means that it's going to go over a longer period of time. This is is kind of, I guess, nerdy little math here, but if you look at the area under both curves, that's the amount of people that are
Getting it.
that really shouldn't change with either one. It just changes the time period in which it happens.
Yeah.
So instead of everybody getting in a 3-month period and you have 2 million deaths, you have it over a 12-month period where you don't overwhelm our hospital capacities, and we can care for those who come in when they come in and try and save as many of those lives as possible. And it sucks. I mean, I've been telling as many people as I can, like, this is, nobody's going to be spared from how much this sucks. I'm lucky that I'm an introvert and spend most of my time at home anyways on my time off. Like, that part doesn't affect me, but I know that that's got to be incredibly difficult for so many other people. And I'm not an economist. I'm not a policymaker. I can't comment on that.
Yeah.
I'm sure that there's going to have to be trade-offs. There's going to be no getting out of this without having the economy take a hit, without people dying. But my role is to first and foremost care for people's lives and health. So I don't think we can say we're being too cautious. I mean, I think we have to be, and at some point we can open up, but people have to understand that if it gets out of control, someone's got to have the balls to rein it back in.
Yeah.
You know, because it could, we could have another spike where, you know, we're at a threshold right now. My hospital, my ICU's full. The ICUs, plural, are full at our main hospital. We have patients who are using special, you know, anesthesia vents, the kind of thing you put on when you're just getting an operation.
Oh, wow.
Those aren't meant for sick patients with COVID. The kind of disease you get with the lungs really doesn't handle that. So the people that are on it are people with other issues that need to be ventilated, but they're not even in an ICU. They're in our, you know, ORs or post anesthesia recovery unit. We're just at capacity. So, you know, I don't want this to be something that spirals out of control, because I tell you, the hardest part has been some of these people send their family members into the hospital and they never see them again, and they die. They don't get to touch them again. They don't get to speak with them again. Maybe we get a chance to get an iPad and put it face to face so they can see their loved one hook up to a vent, lifeless, not able to talk, so that they can say goodbye one last time. You know, I know that's a little bit cheap to give that scare tactic, but that has emotionally been a really tough thing. You know, spending, you know, having to have conversations with people. Normally, you know, what I do is have life and death conversations, but I do it face to face, in person. You can, you know, show some empathy to people. It's hard to do that over the phone. It's hard to see how they're reacting. It's hard to be present and be human for them when you need to be, doing it over the phone. And it's hard for them to see how sick their loved one is, so that they can make the right decision to not prolong suffering or to know when to continue care. So I get it. It sucks. People want to go out and do what they want, but I think it's a sacrifice we're going to have to make for a long while.
Yeah.
So just, I encourage people to do the best they can. A shout out to you. I liked your opinion. I like your perspective on those young dudes who are out at the basketball court a
Oh,
while
yeah.
back.
Yeah.
I thought that was brilliant. I mean, yeah, that's age appropriate behavior. You know, I think what riled me up is, you know, some family member or friend of a family member, some racist person, you know, posted is this why, you know, Hispanics and Black folk are having a tougher time with this, ignoring the, you know, 100,000 white people going to church every week. You know?
Exactly.
But I saw that and I just thought, you know, it's good to have perspective. This is not going to be easy. I think we have to show grace and, you know, forgiveness to people that have a tough time following the guidelines. And I think I have to do a better job. The media has to do a better job of explaining why it's happening and be a little bit more real to people. You know,
Yeah.
bad news is not fun to give, but everybody deserves to hear the truth. So
Yeah. Well, listen, that is Dr. Travis Kinney, a hospitalist in the Einstein Network. Listen, brother, I appreciate you for taking time out to join me today. Uh, just take care of yourself. Take care of yourself. Those are
I'll do
my
my best.
part of work. No doubt. Thanks, Trav.
Thanks so much for having me on, Phil. I appreciate it.
Peace, brother.
Peace, man.
So that was Dr. Travis Kenny. And yeah, it's just a difficult time, man, when we talk about just the importance of, try to get Biggie back in the picture frame. It's a difficult time when we talk about just dealing with this COVID-19. I know I make a lot of jokes saying it's like day 7,033, and we're all just, just passing the days the best that we can, which is true. But I think it's important that we recognize that some people aren't leaving the hospital. Right, they're going in, they're being dropped off by loved ones who have to wave at them by, and this is the last time that they're seeing them, and it's so unfortunate. I think it's important that we do practice these measures, whether we agree with them, whether we disagree. I think it's important. I'd rather be wrong and still do it, right? I'd rather be wrong with practicing social distancing. I'd rather be wrong by practicing quarantine. And like, oh, you know what? At the end of this, yeah, you know what? Yeah, that wasn't the issue. I'd rather that be the case than knowing I'm going out here engaging with other folk, ignoring what the recommendations are, and I uh, am impacted by COVID, by catching this contagion, or I'm impacting somebody else's health, physical health. So again, it's just something to be mindful of when we're out here maneuvering. We're all tired. We're all frustrated. We all are. We want this shit to be over. It's just the reality we do. But again, man, heavy is the head that wear the crown. And what that means in this case is, listen, it's a lot of responsibility, but I think that we're built for it, and we have the capabilities and the capacity to deal no matter when this ends. Again, we have to be diligent in our self-care. We have to be diligent in making sure we're getting information from the proper outlets, which Dr. Kenny spoke about, which said, listen, we haven't done a great job, whether it's the medical profession or whether it's the government, and talking about what these things mean, like flattening the curve or what have you. My thoughts briefly on Dr. Lorna Breen and this idea of her dying by suicide. I just wanted to say that this isn't, when somebody dies by suicide, we often attribute labels to them. We talk about they're not strong enough, right? They didn't have the capacity to deal, to cope. And I've never was one to subscribe that. I always look at it as they have a desire for something more than that they're currently receiving. And so for somebody potentially, Dr. Dr. Lorna, it could look like, you know what, peace. I'm just looking for some type of peace that I can't seem to find here, and that I feel like it exists for me in this afterlife. Again, we have to be mindful. We have to check in on the ones that we love and the ones that we care about. We have to do a little bit more than our faux conversations on social media and text. We need to call people. We need to FaceTime people to check on them, make sure that they are okay, right? And not just taking the standard, yeah, I'm good, for an answer, especially during times like this, high stress times, which can be an acute trigger for somebody to die by suicide. So again, I want to thank Dr. Travis Kenny for coming on and having this conversation on COVID. I want to thank you all for tuning in. Again, you see me with the fresh baldy. I look like I don't know what I look like, but I'm kind of digging it a little bit. As always, we'll be back tomorrow for our Wellness Wednesday when we'll be talking all things wellness. So listen, I appreciate you all for tuning in. Peace.